2.
My name is Luciana da Silva Solter, and I will speak about the HIV, human immunodeficiency virus. The general description is a lifelong condition that attacks the body's immune system, and among other reasons is the lack of the viral knowledge or any binding antibiotics. The disease progression starts from the infection to AHI stage, which is very important stage to health provider because it clarifies the transmission. After that, we have the acute HIV, and in this stage is the highly contagious stage, and some people may know or not they are infected. The next step is the chronic HIV infection, which gonna take it with, if he is untreated, gonna take the patient to the acquired immunodeficiency syndrome, the AIDS. The World Health Organization in 2019 described HIV as a global epidemic with 38 million people living infected. Now, we have the causative agent, uh, which is a member of the Retroviridae family. The lentivirus is roughly spherical with a diameter of about 120 nanometer, is enveloped across a hydrovirus with single-stranded RNA. We have two pathology strains, HIV-1 and HIV-2. The HIV virulence is defined as the rate to AIDS. Now, the transmission, in the transmission, the HIV originates through chimpanzee, and the animal version, name is simian immunodeficiency virus, was transmitted to humans by eating the meat of the primates with the HIV infected blood. In this term, we could call the disease zoonotic, but after that, today, we just have the transmission among humans by bodily fluids in several ways. The most common is the vaginal or anal sex. We have also the sharing needles or syringes for injection of drug use, or sharing tattoo equipment without sterilization, or during the pregnancy or labor, during the breastfeeding, or through a blood transfusion or organ and tissue transplant. The manifestation of the disease, the acute HIV infection symptoms present after the AHI period, what they call eclipse period, usually 10 days later. We have the stage 1, acute HIV infection. Acute HIV infection, it became a chronic HIV infection. And finally, the third stage, what is acquired immunodeficiency syndrome, AIDS. The disease pathology of HIV is a battle of HIV replication versus immune responses with the white blood cells by way of both cell and immune mediated reactions. HIV virus impact the CD4 T cells destruction both directly and indirectly. Now, we're going to the treatment and prevention. This medication therapy helps to keep the HIV from progressing to AIDS. We have several options, and the best prevention methods include being tested for HIV and other sexually transmitted infections. Use condoms, avoid sharing needles or other paraphernalia. Thank you so much.